Thank you very much, Presiding Officer. I just listened to Sue Webber there. I'm not sure if Sue Webber's actually saying that there was never any potholes in Scotland until the SNP came to power, or there's no potholes elsewhere in the UK, judging by her comments. But, Presiding Officer, whilst all the parties represent... Sure, no problem.
Sue Webber, briefly.
I'm pretty sure you were expecting... The intervention was expected when I was mentioned in the opening remarks, but I think constituents of mine are sick fed up of potholes. They want them fixed. They want them filled, and they want the money to get to local authorities to do so.
Stuart McMillan.
So, I mean, yeah, there are potholes. There are potholes all over the place, but certainly, yeah, as my colleague quite rightly indicated, in Edinburgh, it is run by a coalition of the Conservatives and Labour and the Liberal Democrats. So I would suggest that Sue Webber contacts her Edinburgh City Council to get the potholes fixed. Contact her own colleagues to get the potholes fixed. Now, also, whilst all the parties represented in the Chamber hold differing views on various issues, and I do believe that for the most part we all agree that Scotland's public services are the backbone of our society, and where we disagree on this typically comes down to how public services are funded and how they are run, particularly the NHS. That's why I did find it a bit confusing with Labour's logic. It seems to indicate that 14 years of Tory austerity only adversely affected the finances at UK level, but clearly not to the devolved governments across the UK. Now, with this is despite that the SNP in government consistently have provided record funding for our NHS, and this budget is no different, delivering a record £2 billion increase in frontline NHS spending, taking overall health and social care investment to £21.7 billion, which includes an increase in capital spending power of £130 million, certainly from 24-25. Now, I make special mention of the increase in capital spending power for our health service because of my constituency. Now, we need a new build health centre in Port Glasgow and further investment in the Inverclyde Royal Hospital, and the Cabinet Secretary is very much aware of my concerns in these matters. Now, I remain of the opinion that the IRH does need to be replaced, but I recognise that capital required for this project is significant. However, investment into the building is taking place, and I did welcome the funding from the Scottish Government to deliver the new Greenock Health Centre, which opened in 2021. Now, this new facility supports a wide range of services and provides access to high-quality healthcare and offers a more welcoming environment for staff to work in, as well as patients. And that's why the plans for a new build Port Glasgow Health Centre must be progressed. And I know from recent correspondence that I've had with the NHS, Greater Glasgow and Clyde, that the project does remain a priority. And that's why I also welcome the news today that the Scottish Greens and the Liberal Democrats will be supporting this year's budget, because that will actually help provide the Health Board with much-needed clarity on what capital resources it's going to receive to inform its infrastructure planning. Now, speaking of healthcare more generally, it would be remiss of me not to mention the impact of the UK Labour Government's plan to increase the national insurance contribution. It's already been touched upon by some colleagues already today. Now, as it has been widely reported, this policy, which is a tax on jobs, will have a huge impact on our health and social care services and also public services overall. Now, it's disingenuous for Labour to boast about providing Scotland with a greater budget settlement, only to ignore the implications that their NI tax hike will have on Scotland's finances. Now, this is because the financial burden of this wipes out over... 2 seconds. This is because the financial burden of this wipes out over £700 million that's been provided to the Scottish Government, meaning that our public services and also third sector organisations will not be able to reap the full benefits of this investment.
Briefly, Michael Mann.
I appreciate the member giving way. Does he recognise that the Fraser of Alder Institute have set out that the cost of the proposal set out by the Cabinet Secretary would actually cost the Scottish Government, the Scottish Government's budget, £636 million?
Stuart McMillan.
I've heard what Mr Maris had to say, and I'm very much aware of the document, but that's one of the things, certainly in terms of politics. There's a whole range of ideas, a whole range of suggestions, and actually not everyone is always right. But certainly one other aspect of this is that Labour have failed to acknowledge that Scotland's got a larger public service workforce than England, so using the Barnett consequentials, we're not being provided with the full amount needed to cover the extra NI cost. And I have written to the UK Government specifically about the impact that Labour's national insurance hike will have on Scotland's social care sector, because as organisations working within my Greenock and Inverclyde constituency have expressed their concerns to me, and I do have to say at this point, I am the chair of Moving On Inverclyde, an addiction service. They haven't expressed these concerns to me. I truly hope that Sir Keir Starmer's government listens to these concerns, and I would expect Labour MSPs in this chamber to also raise the issue with their Westminster counterparts. Now, let's be clear, this is the Scottish Labour Party that time and time again comes to this Parliament, challenges the Scottish Government on a range of issues, yet they have stayed silent on the fact that their Westminster bosses are raiding Scotland's healthcare budget by increasing the NI burden placed upon the NHS, but also across the public services, certainly as you go forward next year. But Presiding Officer, I am conscious of the time. So with this, I genuinely think, Presiding Officer, that we know where Labour Party are. We also know that we've had 14 years of Tory austerity, as well as the Trust quartine budget, which wiped out over £40 billion from the economy, shows that Tories have got no credibility in managing the public finances. So we shouldn't listen to them when it comes to anything to do with the economy. Thank you very much.
Thank